All right, this is Tariq for DaBear Facts podcast, DaBear Truth segment, clinical check-in. Now, I'm coming to you, I'm making this like my Rico talk. So, I don't know how often I'm gonna be uploading, but I'm gonna be uploading. I'm gonna just say, like, I'm gonna wing it. I wing it on a other podcast. I'm gonna wing it here, but if we build an audience for this, it's whatever. But I'll come with different topics. Like I said in the introductory podcast, I really want to stay on top of it, but it's been hectic. I've been trying to scramble and do a lot of different things. So when I envisioned this podcast, this is basically like, I'm an MSW grad. I'm a clinical social worker. So, my goal starting out was to become a psychotherapist. Now, I got my bachelor's degree in psychology. And then, like I said, I got my master's in clinical social work. Now, it's different things that's come with that. Like, it's not only like, a lot of times you'll hear in the field, like, the difference between psychology and clinical social work is psychology is how the mind develops throughout the life. And clinical social work is how individuals develop amongst all the different factors and systems that they interact with. So it's still development. Psychology focuses on the mind. Clinical social work takes a holistic approach where it looks at socioeconomic factors. It looks at biological factors. It looks at hereditary biological factors. It looks at environmental. I don't know if I said that. No, I said socioeconomic, and then I said environmental. So it looks at them different types of things. And, how these things contribute to development. So, and like I always say, like, people can go through the similar things, but similar things can make differences in people's lives. And it goes like that with mental health as well, like, or just personality or, development as well. Like, poverty might hit two different people differently. A trauma could have different effects. And like, when you talk about traumas, you can talk about different traumas, but I think commonly traumas are known as something like super traumatic, like super traumatic event. But different things, anything that can change the brain chemistry, change the individual's behavior, anything like that can alter the cognitive development or cognitive responses that impact you in like a negative way could be a trauma. So it could be poverty, it could be domestic violence, it could be substance abuse, it could be witnessing violence, it could be attachment, it could be neglect, it could be different things. Like when I think of like not so much attachment, but when I think of like, just desensitization, there's different things that, or just witnessing violence in general, like it can desensitize you. There's theories that it can replicate explosiveness, anger, aggression, and those that witness it. And then it could be just a detached desensitization, like, okay. So, like, different things can affect you differently. Like a lot of times I speak about the agitation and aggression that are external responses in depression and anxiety. Because we all know, like, some people will tell you they might not nobody's going to self-diagnose, or they might not identify it as like, yeah, I mean that, but people will tell you, like, when they get a little anxious, I get a little snippy, I get a little agitated, I get a little, like, get bothered me, frustrated, so. But, like, and depression. Like, you know, it can be the same thing. And when I think about socioeconomic disparities, when I think about poverty and stuff like that, like, you know, a lot of times, I think I've said this before, like, I don't ever want to look at things like, oh yeah, like, you know what I mean, people are just animals, or, you know what I mean, or there's no unredeemable qualities, or there's no rhyme and reason why certain things happen. I'm not going to say why certain people act like that, but why certain people take certain routes and do different things. Like, there's reasons that spawn and develop from different things. Like, even in affluent places, like, attachment can be, like, you know what I mean, you know, a big thing. That you could come from poverty and be a well-rounded individual. You can come from a place of affluence and be an a-hole. You can have anger issues if you come from money, or you can have anger issues if you come from poverty. You can have anger issues if you come from middle class. If you have a broken family, that can be considered a trauma. Like, a lot of times, and you see this a lot, like, if you ever watched the series Intervention, a lot of those individuals had some type of attachment trauma. Like, a lot of them individuals lost a parent, or were in and that's from different socioeconomic backgrounds. A lot of them people that I've watched, they're not even from poverty. They just from a situation where either, most of them, I'm not going to say every episode, but a lot of them that I've watched have that broken home aspect. And then they also have either some type of abuse or some type of substance use in the household. Now, I say that because, like I'm saying, like, when I say trauma, when I'm talking trauma, like sometimes, like I say, we go to that extreme, like a shootout, or like witnessing somebody die in a car crash or something like that. But, like, sometimes it's just that, like, you know, that tear apart of a family. And, like, you know, everybody, like, we don't blame anybody, but at the same time, sometimes, I'm not saying in every case, sometimes, like, but I'm pointing to that series because a lot of people tell their story, and through them telling their story, they indicate, like, you know, their favorite parent left the house. And then initially they kept in contact, and then in certain series, some series they say that they lost contact. Other series say that it was a gradual fade away, and sometimes the parents didn't get along and they gradually faded away. So sometimes it's just as simple as a broken family. You get what I'm saying? And like I said, I was discussing Intervention as an example. And I think they're in like 23 seasons, 24 seasons of Intervention. And like I said, I use that not just because of that broken family rupture that spawns that trauma in the individual at a young age. And like I said, a lot of the times it's losing that parent they were closer to or had the secure attachment with, that spawns off the trauma, that then spawns off a depression or anxiety or whatever. And then that the individual starts self-medicating, not in every category, but, you know, I like I said, I use that as an example of a trauma, but not in a gun shootout or a war veteran or something like that, but something that can still impact you deeply. And if you're young, it can still affect you into adulthood. Like, there's other instances where, you know, you might experience a trauma and that might cause you an anxiety. Like, it might be separation anxiety. It might be just different types of fear or phobias because of this trauma. Like, you know, a lot of times you experience the trauma and you might want to avoid whatever triggers you. You might want to fight, flight, response, freeze, and it is to hit the flight simulation, like, you know, but in a lot of instances, it's different things. I point to that because, like, you know, like I always say, I like to go with the stuff that isn't normal. You get what I'm saying? And, like, you know, I think it's informative psychoeducation, you know, because, you know, in that way, sometimes you go to somebody for help. And like I said, and a lot of times, and I've been in the field 10 years. I've been doing direct therapy for about 3. And like I've done therapy PRN before that, but I've been doing it direct, and that's a joke, like, you know. But counseling, PRN. But you know, a lot of times, like, somebody might present to you and say, like, yeah, I need help sleeping, or I need help with anxiety, or I need help with anger management, or I need help with whatever it is. But in talking to them, like, sometimes it's right off the bat. Sometimes it's during the intake. Sometimes it's during the assessment. Like, it's weird to me because I know how my mind works, and my mind processes information in an analytic way. So it's like, yeah, I mean, it's like just different compartments and different components and puzzles to the whole. And like during the assessment process, a lot of times, like, you know, I'm hearing markers, or I'm hearing, I'm not going to call them red flags, but flags, like, to pay attention to pick up on, or bring back up, or ask for. Like, I know they say the assessments are supposed to be rapid. I'm still, yeah, I mean, but so they get the best response or whatever. But sometimes it's like, all right, so you telling me this and telling me that, and sometimes I'll just write it down, because then it's something during session to come back to and really get you to expand on. Because like, in theory, I know different theories that those markers might contribute to what you're saying is the presenting problem or issue, but in the individual's own words, it's like, this is my presenting problem. I don't know why I can't change it. And a lot of times, like, this is what I'm saying, like, this is the presenting problem, but the underlying problem may not be like a straight line to that problem. Like, it might seem like it has nothing to do with that problem. Like I said, like, a lot of times, like, when it comes to certain approaches and stuff, they might look at it like, yeah, I mean, something in your past or something in your developmental stages caused that development to change course, or you alter your cognitive processing, or, you know, like, you know, I don't want to say lay dormant, but, you know, like I said with the anxiety, like, there's different instances where somebody might have been living a normal life as a young kid or whatever, and then they suffer trauma, and then they might, like, you know, start to get more anxious, and then they might be more fearful, and over their lifetime, that might develop into other things. It might get worse, and it might worsen, and it might present in different ways. You get what I'm saying? So, like, you know, it might be I was talking to my mom the other day, it might be a fear of delegation. It might be a trust issue in a personal relationship. It might be these different attachment issues. But then again, like, it might be an avoidant thing. Anxiety is like, I want to avoid that. Like, so what I'm saying, in some instances, you might cling to people. Like, you might be very clingy because it might, like, whatever the trauma was, you might be afraid of losing that person, or afraid of losing whatever it is, or a fear. And when I say a trust issue, sometimes it's like a fear of losing control. Like, and I don't mean in a violent way. It's just like, I know how I want everything. I know how I need everything. I know how everything is perfectly packaged for me. It might not be perfectly packaged for you, but it's perfectly packaged for me. And as much as I love you, it's not really you. It's my past trauma. Love you to death. No, I'm not trusting you with this responsibility. That's all me. I'll take that on my shoulders. And sometimes it's just like that. And that's as hurtful as that might be, because, like, I've been in certain brief family sessions where, like, you know, as hurtful as that might be, it's still like, yeah, I mean, like, that's the way that they really maintain their control, is by not giving up any, and that's how they keep their comfort and their comfort level, by shouldering everything. And, like, you know, I can be the same way, but I'm not talking about myself. it's just a pattern of behavior. You get what I'm saying? And that's what I'm saying. Like, other people might be on some, like, they might have trust issues, but it might be stemming from physical abuse or abandonment or uh, different things. You get what I'm saying? It probably could both stem from both things, but like somebody might not be as anal retentive, or they might not be as, I don't want to say OCD or something like that, but they might not be like, sometimes the neurosis is caused by like that, like I said, like even me, and I'm not talking about myself, but like the way I deal with my anxiety is I have to have everything, like, you know what I mean, in a certain, you know what I mean, like, you know what I mean. You probably don't know what I mean if you're watching this, but anyway, I'm gonna cut down on the, you know what I mean. But anyway, so even with me, like, I know how I like everything organized. Like, I might not be the most organized in my personal life, but like I gotta stay on top of bills. I gotta pay. As soon as I got money, I pay whatever it is, even if it ain't due for a while. Like, because that'll keep that anxiety at bay. That'll keep that anxiety at ease, and I feel comfortable. It's hard for me to delegate responsibilities, not because I don't trust the person, but usually I probably won't. But at the same time, it's just like, I just know, like, and like I said, even that hurt feeling that you don't trust me, I get that. But at the same time, for me, and I'm not saying I'm better or worse than anybody else, I just feel like, like I know people that will look at it like, I don't trust you. And that's simple as that. I just don't trust you. For me, it's not, even though for me, like, I've had trust issues throughout my life for various reasons. But for me, it's more like I rather, and I'm not saying that this doesn't happen in other people, but I know for my case, it's like, if it doesn't happen, or it doesn't, a responsibility doesn't get done, one, I'm not going to want to hear like, yeah, I agreed to do it, but then I didn't do it. I'm going to be pissed off because I trusted you to do it, and usually I'm not going to trust you to do it. Simple as that. Even in the most trusting cases, even when that's like, oh, I get down with this person. I get down with this person. There's something in me that's like, no, I love you to death, but no, I can't trust you with this. I got to get it done. And then on the other hand, it's a totally nothing. It's a totally detached from the individual situation. It's a, if it don't get done, it's like I can only blame myself because I was the one that was going to do it. You get what I'm saying? If I give it to you and you don't get it done, I'm gonna be upset. But if I take it on and I get it, if I don't get it done, then it's only on me. I can't blame you for it. I can't say that, I trusted you. I can't be scolding you, even though in some cases you deserve it, but I can't be scolding you and stuff like that. Because, like, but that's my own hang up. You get what I'm saying? And eventually you're going to have to learn to trust people. And the whole thing about that, for me, is like being able to surround yourself with a cast of characters and a crew of like-minded individuals who want the same goals as you. Now, haven't had that. I haven't been able to establish that, but I'm still working on it. But I feel it's out there. It's just, I'm going to leave that alone. But that's still like, an anxiety. So like I said, I go through these things because, like, I think people just assume, like, you might have a social anxiety, you might have generalized anxiety, and then like there's different types of anxiety. And then, like I said, some anxiety is stemming from a trauma. You get what I'm saying? And the reason why I went through all that is because, like I said, for some people, I'm not talking about me in every situation. I'm not talking about anybody in specific. I'm just talking theory. So sometimes, like, you might be 36 and you are struggling with your romantic relationships. You're okay at work with communicating and socializing, and you're a social person, but like you're not letting people too close. You get anxious in certain situations, but not all social situations. You're fearful of losing certain things, but you can't understand why, and then you come to me, and it's like, Doc, I'm not doctor, Masters. The Masters is me. Anyway, so then you come to me, the therapist, and you say, therapist, I have extreme anxiety and this, and that, and that. And then, like, you know what I mean? The more we talk, the more you reveal, the more I interview you, delve deeper, probe more. It's like, it's revealed, like, you know what I mean? Like, well, it might be the first session, it might be the 15th session, but eventually, like, usually it doesn't wait till 15 sessions. Like, it usually doesn't. But it might be a situation where it's like, yeah, I mean, something's revealed, and it's like, okay, like I said, those markers and flares go off, and it's like, all right, so stop right there. Let's explore that, and then it might be from a trauma. Like, as much as you might not think it's from a trauma, it might be revealed. Like, yeah, I mean, like, oh, all right, so I used to sit at my grandmom's, and my dad used to drop me off, and you know, I don't know, my grandmom had this horse that looked like a statue of a murderer that used to freak me out. And every time, and my dad used to put me down right next to this horse strapped in a car seat. And you know, as I got older, I'd just always be afraid of this horse. And then, like, yeah, I mean, I'm giving you an example off the top of my head, but, you know, it might be something, like, that's revealed like that, and then we delve deeper into that, and then, like, you know, and I say it like that because, like, you know, a trauma at 4, a trauma at 5, I know I said a car seat, but ease up. A trauma at 4, a trauma at 5, and that lasts throughout your development and growth into your adulthood, and like I said, you're an adult, so it's like you might handle the neurosis differently. It might still be a jitteriness, it might still be like a snappiness, it might still be a avoidance, it might still be a fear, like you know, you might, like, some people might handle it like lighting a fire up under somebody just to, like, you know what I mean, calm their nerves or whatever. And like I said, I point to that intervention series because, like, it's different episodes that I'm watching it, and it's weird because I watched it on and off since it came out, but, like, as I went through school, like, looking at it through a clinician's lens, I could see it differently than just watching and seeing the person that's going through it go through it. You get what I'm saying? And even talk about traumas and how they manifest. Like I said, watching that, it's like sometimes you can see, like, when they say, like, different things, like the person that's abusing substances isn't the only person that abused substances in the family or whatever, and just like the person that goes to jail ain't the only person that goes to jail. Like, you can see the ripple effect. Like, there's been times where I talked about a specific episode. I don't know if I talked about it, so I'm not going to talk about it today. But, like, you know, it's just certain things that might, you know what I mean, stem certain responses. And like I'm saying, later in life, they might not look or feel to an adult like they did as a developing youth or whatever you want to say. Because, like, you know, as an adult, you might not be as afraid. You're not going to be as afraid of a lot as you were as a child, but you're still going to have that permeating anxiety might still lay in you. You get what I'm saying? So, like, you know, talking to the therapist or whoever you're talking to might reveal how these things stem from different, whether it's core beliefs or traumas early on. Like, you know, and, like, to me, like, even the core belief might be shaped in covert trauma or something like that. That's just how I see it. A lot of times I'll tell, and I don't know if I said this the last time, but sometimes, like, that's why I pointed to different things, because, like I said, it's less obvious. And I don't know if I said that the last time when I brought the clinical check-in to the podcast, that, you know, that instance where I use this as an example. Like, you know, you grow up and you love your grandma and you love your mom, and I'm not talking about anybody specific. This is not me. I'm not talking about my personal life. I'm not talking about a past client. I'm not talking about anybody. So don't, just a disclaimer freestyling. I am not talking about you. Don't personalize them. But anyway, uh, so I was in a group and I was just freestyling a group. And I'm saying, like, sometimes with the best intentions, you can create or manifest unwanted psychological hang up. And I don't really like saying it like that, but for some reason the terminology escapes me right now. Not that I want to clinical jargon you, but like I was saying, like sometimes you go to your favorite aunt's house, your favorite grandma's house, and you love your favorite aunt, you love your favorite grandma, and just playful. They're not even calling you fat, but playfully they might pinch your love handle or your spare tire, whatever you want to call it, your stomach. And they do it every time they see you, and they don't mention anything about your weight. They just pinch you on the side, like, Now, some people might mention your weight, but either way, I go with the not saying nothing because, like I said, this can still spawn this. That can spawn, like, different things, like a body image insecurity or something like that. Just pinching the fat, and then, like I'm saying, like, you would think in most cases it's just a cute thing. It's just a loving thing. You get what I'm saying? It's like somebody maybe flicking your nose or something like that. But in certain people, I'm not saying in all cases, like every time you pinch the fat and over like maybe the lifetime and lifetime and lifetime, like you might have different responses. You might have somebody have that insecurity. You get what I'm saying? Have like, they might start thinking like, am I too skinny? Like, or am I too fat? And some people might like that, they might find that, like, it reminds them of their favorite person, and you being, maybe they look at it as a healthy form of affection. I'm not judging anything, it's just some people manifest differently. In other ways, it might be like, it might get to your brain, like now you start obsessing almost, but not obsessing, but almost obsessing about like, am I too fat? As this noticeable, this little love handle. It might not even be a love handle, but you might start getting that neurotic hang up, and now it gives you anxiety. Now you might start having body image issues, but that's just something that might stem from something that's harmless. You get what I'm saying? And the reason why, like I said, I bring that up is because later in life, like, it might blossom into anxiety. It might blossom into a body image issue. It might blossom into anger management or anger issues. It might blossom into depression. It might blossom into like cutting or something like that. It might blossom into like, not wanting to leave the house or it might have a social anxiety response because you might be so fixated on your body image that, like, you might, I don't know. And I do know, but like, in a hypothetical way, it's like it can manifest in different things just off something that harmless, even like just that loving, affectionate, but each time you do it over again, it's like, all right, now your brain is like, starting to play tricks on you, and if you will. But like I said, in a different individual, it might just be something that's affectionate that they love to do, and like, it might not have any adverse effects. So I don't know, like, people are individuals. The mind is it's a beautiful thing, and like all that I just explained, like, it fascinates me, like, delving into the who's, why's, what's, when's, and the manifestations, and like, how did you get here from there. But like I said, even with the series intervention, like, I can see even through, like, and it's even crazier to me to see that ripple effect, to see the systems that the individual is either hurting or affecting. You get what I'm saying? Like, it's not just the codependency, but it's, like I said, like, and like, for me with lived experience, I can relate in the lived experience way, but like, like I said, when I'm watching the series and it's like, all right, so this person is developing anger management, not because of the substance, but because of the substance abuser. this person is developing extreme anxiety because of, and like I said, I don't want to keep going over this one episode of, because when I was talking earlier, I'm talking about multiple different, but this was one episode where like it was like generational substance use, and then the two younger kids of the main featured individual, who again was suffered a rupture of their nuclear family, and the one that they had the attachment with left, and then they started partying with the mom because the mom wanted them to be good, but the mom wasn't the mom. The mom was the best friend, and basically that comes out. I'm not diagnosing that. That comes out, and then like the individual that's featured suffers a series of traumas, and then she starts to get hooked on like pain medicine. And then, like I said, I don't know if I said this in another podcast, so like I don't really want to go too deep in. You see how even though the episode is focused on this individual, you see how the oldest son is angry and resentful, and like he has basically dead eyes and anger. Like he punches walls, he flies out a handle, he flights and fights, and so and it's like, you see, as a clinician, you see different things develop that have already developed. Like he's probably like, I think in that episode he was like 17. I think he was about to turn 18, so he wasn't full adult, because there was an issue about him staying at his girlfriend's crib, who was of age. And like there was a lot of explosions with this individual, and then the younger son. And like I said, the older son, well, I didn't say this, but I'm saying it now. The older son felt like, I raised myself and I raised my little brother. I don't really need you, and you can't really tell me nothing. And it was like, even when he was quiet, calm, it was like just a blank stare, and his face detached, like I don't even deal with you like that. Like I'm just here, like I ain't got no feelings for you. I got feelings for my little brother, but I don't even deal with you. I don't even respect you like that. And like the little brother had found the mom OD'd twice, and the little brother was like 11, and the little brother, like every scene you've seen the little brother, and he was crying. That's it. He was talking but crying, and it was like he said throughout the episode, like his biggest fear was finding his mom passed away. Like I mean, so these are things that they're going to have to deal with for the rest of their lives, with like especially the 11-year-old, like as anxious as he was. And this was probably, this episode, I don't even know, this might have been like 10 years ago, 6 years ago. So like he would probably be like, if he was 11, 13, he would probably be like 19 now. But like that, as an adult, he was probably going to be a very anxious adult. The older brother got, he'll probably be more detached from that individual. He might find that self-object that's called in the field, like in like a girlfriend. Like he might, I don't know if it would have been that girlfriend or somebody else, or even if he sought therapy and they built that therapeutic alliance. But if not, he might go through the rest of his life with trust issues, anger issues, not relying on too many people, because like I said, he basically raised himself. He didn't have any respect for his mom, his stepfathers. He basically cursed out his stepfather. And then I think he had another stepfather or something like that. Or I don't know how close he was to his own father, but he was telling his stepfather, like, dude, you like a drug dealer. She just calls you when she wants you to go get the perks. And then like the neighbor who had, she had some type of muscular dystrophy or some stuff like that. The neighbor had some type of illness where she was in pain and stuff like that, and she was giving her meds, like, and she was the unofficial housekeeper, and she was putting up with verbal abuse, and it was crazy. But I empathize with the older brother, but more with the younger brother, because one, he was younger, he found her OD twice, and like I think they said that like the one of the times he called the ambulance and laid on the floor with her. So like these are traumas. These are like what I mean. And like I said, they weren't living in poverty or nothing, like, but certain things can affect any social economic group. And like I said, like throughout the episode, they were saying, like, both the kids were like, she don't really get out of bed except for to smoke cigarettes in the garage and do her pills and go back to sleep. Like, and at one point, I guess the younger brother was like the only person in the house with her all the time. And I think that even he went to go live with his dad, but I think he was so scared that his mom, there would be nobody with his mom, he came back. So, you know, I use that all the time because, like, you know, like I said, the feature was the individual using the substance. They didn't even, they got testimonials from the son, the older son, the younger son, even the neighbor, but the focus was on the mom. But through my clinical eyes, it's like I'm seeing how it rippled through the rest of the family. You get what I'm saying? Like they didn't fixate on the other two sons at all. They had enough interviews and stuff like that, but you know, like, you know, I'm not anybody special. I think any clinician would probably see it the same way. I'd be interested in hearing, like, you know, what people thought as clinicians. Like, you know, I'd be interested in, I don't know, like, different episodes, just seeing how they would react or people would think of it, because, like, or what you would see in different things. But I don't know. I was working at this one organization. I think I was working at a couple organizations that they use the episode intervention every once in a while for the groups and stuff. But, you know, like, in any case, it's not just anxiety, but, you know, like, I talk about anxiety a lot, but even depression, like, and like I said, when it comes to my thing with depression, we all know that the depression symptoms where you're sad, unmotivated, all that. But, you know, there is an agitation factor. There is an aggression factor. There are external responses to that depression. It's not always just sit in the bed and cry and build a pillow of tissues. Like, some people do have that, yeah, I'm depressed, but, like, you know what I mean? And you might not even know it, like, because it's you're on edge more, you're extra, you know, like I said, snappy, snippy, whatever you want to say. And it's not always just, and I'm somebody who strongly believes that, like, just a mental health symptom is not a weakness, and it's not something you should treat somebody as being weak. It's somebody like that might need medical attention, mental health attention. But it's a condition, like I said, like the people, like, it's like lung disease, like asthma or something like that. Like, you know, there's treatments and there's ways to deal with it. It's not just get off your butt. And, like, sometimes, you know, motivationally, yeah, motivation and helping individuals get motivated can help, like, empower and then, you know, build motivation and stuff like that, and energy level, raise energy level. But it's not just all right, get out of bed, you're getting on my nerves. That ain't gonna work. It's not. But, you know, I'm just saying, like, you know, even with depression can stem from different things. Like, I'm not surprised, like, you know, you got different types of depression, whether people know it or not. Like, sometimes depression can come from grief and loss. Sometimes depression can be attributed or connected with a single event that makes you depressed. Like, and then, and that could be like a job loss. That could be a health condition. Like, you know, it could be a health condition, but, like, you know, that true depression, major depression, stuff like that, that's more of a chronic or acute type thing. It's not just a one-time, two-time things, I guess, or something that's situated or connected to precipitating event, or what they would call an antecedent. But an event before the depression. But, you know, and I say it like that because I said, like, you know, some people get depressed like every 4 years. Some people might get depressed like every 6 months. Some people, it might cycle. And then some people might just randomly get depressed. But, you know, depression, like, if you're diagnosed with depression, it's usually like a couple of episodes. It's not just, like I said, an event, then a response to the event. But, you know, Like people, and when it comes to bipolar, the thing about bipolar, which is depression and mixed with episodes of mania or hypomania, is basically the same thing. The only thing is, like, you know, they say that most people with hypomania or mania don't really get diagnosed unless they have a depressive episode, or their mania is so bad that they reach exhaustion and got to go to the hospital. Because they say that people, like, whether you're manic or hypomanic or whatever, like, they'll keep going until they burn out. You get what I'm saying? And then it's like either you burn out, you fall out, sleep, get back up and do it again, or you need to be hospitalized. Other ways that they say that people on the manic end, because like when you're bipolar, you can have like depression that's major, and then every once in a while have some mania or hypomania episodes. Or it can be reversed, where you could be always on go mode and just every once in a while get low. But they say it's not usually going to get diagnosed, like, unless you know certain, and I'm talking about the mania, like the mania ended polar. It's probably not going to get diagnosed unless you like are on a spending spree and wilding out. If you're doing some risky behaviors and wilding out, or you do some risky behaviors and you end up in jail, or you just are going. Like some people, like they say, like some people look like they're on drugs, like when they're in a manic state, like you're going for like 4 to 6 days, like no sleep or little sleep, and like going. And but like I said, you know, most people like that don't really care. They just enjoy the energy, and they like, you know what I mean? And that's why I said it has to be in extreme cases where you're in the hospital or in the jail cell and you calm down and like, what just happened? Other than that, it's like you're gonna go however long you go, and then you probably gonna flop out for a good night's sleep, and then you're gonna go some more. Believe me, I've lived with the experience. I know. I do it all the time. I've never ended up in the hospital because of mania. I've never ended up in jail cell, thankfully. Not, I don't think I ever have, but like, you know, early in life, I might have. But, you know, I can say that I've met most of the other markers, but I don't really, I stay at my baseline and a little elevated at times to hypomania. It's only been like four full-blown manic episodes I believe I've had for since I would say since like 2003. And I say it like that because, like, you know, I have nothing to hide, and you know what I mean, I can tell you firsthand, like, go mode, you get a lot done if you're familiar with outputs. And I'm not suggesting it, but you know, I'm not suggesting people, because you know they have things that keep you even keeled. But like, if you are good just on go mode, then what's the problem? If you're not going to end up in the hospital, if you're not going to fall out from exhaustion, if you're not going to, like, you know what I mean, like, why tether a balloon? That's how I feel. I might be wrong. I'm not, like I'm saying, if you're like, all right, so for me, like I said, I'm baseline. I might get to hypomania, and that's just more go mode than go. For certain people that reach mania all the time and continually do, like for me, I like to channel my energy in the work and output and productivity and proficiency and efficiency, and just keep going and going and going. Now, like I said, traditionally, like I ain't gonna say traditionally, but the things that get people really worried is when you are having risky sex, sleeping with prostitutes, or drug binges, or shopping spree binges. And it's like, that's not me. The only time I've done the shopping sprees is when I've had a lot of money. What I saved the money for I wasn't able to use the money for it, and then I was like, I got money to blow. There have been, I wouldn't say there have been risky sexual behaviors. I'll say, like, you know, there have been risky sexual behaviors. I'm not going to get too much into joking. You got to look at the other segments for that. But it's been a couple, I don't know if what you would call risky. Like, I've always used protected sex, and like, it's been different times, but I'm not gonna go too far into that. But I've never come up with an STD, and I've never had an unwanted pregnancy. I've had pregnancies that I've never had an unwanted pregnancy, and luckily I've never wilded out on, I would never say I would wild out on drugs like just drug binges that's going to end me in the ER or in a joint. But like, I know when my thing is like, if I get manic or hypomanic, I'm probably going to chase girls, but I keep my hands to myself. Like, I can take a no, but I'm probably like, it's seldom that happens. Like, I can talk to girls without getting worked up, and I can talk to girls and have a good time and be silly or whatever, but like, I'm never going to just be inappropriate or grope you. And I'm not saying that that's a thing that happens with people on that end, and I've never committed domestic violence. Not saying that that's a part of it, but if I get manic, it's not going to be, usually it's not going to be like a shopping spree. It's not going to be a shopping spree. Like I said, the only times I've done that is when I had money to blow, and then there's one other time where I felt like I was busting my fist against the wall. But now I don't have any money. I don't have no money to blow. I don't have no, fist to, but I have a fist, but no wall to bump up against. So it's like, I'm broke. But again, like, like I said, for me, like when I'm in that instance, and it doesn't happen not a lot, and throughout the last like 10, 15 years, I've learned my triggers. So it's like, and I've also learned things that make me feel better about cognitive processing of events that usually trigger me, that usually makes me feel better about, outcomes and whatever. But like I said, I'll probably just go like, and like, in a relationship, I'm a monogamous guy, but as single, like if I'm triggered, and my trigger is usually like thinking that my girlfriend's cheating. Now, I don't always, like in the last couple of relationships, I haven't thought that or got there. Like, there was like a time where I guess there was a breakup and I went and flirted with a bunch of chicks. Then there's other times, but that's usually a trigger. So like, but I know this. So, but my thing is, like I said, I'm a monogamous dude, or like I've said in other podcast segments, like, however we define our relationship. I'm not going to get into that here. But like, I feel like I'm a monogamous dude. So as long as you monogamous and there's no signs, and even now with lived experience in life and older age, not just like, substance abuse, crime, and whatever you want to say, just learning knowledge and experience gained throughout life. It's like, all right, so like I say, like, that don't always solve things. Like, if I'm single and there's reasons for me to, like, flirt with multiple girls in one day, if I keep getting rejected, then it's usually just having fun. But at the same time, like, in real situations where I have feelings for somebody, I've learned, like, just playing, like, not just flirting with girls might be fun, but it's not going to solve anything if we break up. Because I'm probably still going to have feelings for that chick, or like, But if I feel like you're cheating, it's not going to solve anything, because it's like, if you're cheating and I cheat, then that just compounds the issue. If I think you're cheating and you're not cheating, and I go cheat, no, I'm the cheater. So, it really doesn't solve anything. And then there's other things that I'm not going to get into, but, I just self-disclose that because, like I said, it's like stigmas and stereotypes. Like, I know me. I can just say like that. I know me. I as a therapist, I know the illness or condition, whatever you would like to call it. And like for me, like I said, it's just like all right, so am I going to, I know what I'm dealing with, either with myself, or I know what I'm dealing with in other people. And I just, like I said, just like with the depression and the anxiety, I go to certain things, like when it's bipolar, everybody knows depression for the most part. And even with the bipolar, that agitation and aggression can be a part of it. So like, that's what I usually go to. And I use myself because, like I said, the mania and the hypomania end of the bipolar spectrum is lesser heard about, lesser talked about, lesser known. And I don't want people to just think you're a maniac like Jack Nicholson from The Shining. No, it's just like, you know, and like I said, there's different medications, there's different treatments, there's different things you can do. Like, even like me, like, that's a big thing when I get triggered as far as certain things with the flirting with girls. But again, like with the mind racing is the thing. Like, I joke in my other segments, like, my next idea hasn't come yet. So, like, that's my thing. Like, my mind's always racing. And I was telling people recently, like, I've always had trouble sleeping, but I've never been tired. So it's like, I've never really had an issue with having trouble sleeping. Like, when I get to sleep, I stay asleep. And the funnier thing is, like, if I'm with somebody I love, care about, and trust, like, I'm asleep. Not only do I sleep, I be so deep in sleep, I shake houses with my snoring. Like, I've been doing my own sleep study and recording myself sleeping, and I don't make a sound when I'm with every girl I've been with. Every girl I've been with, like, yo, you snore. So, like, I don't know. And, like, usually, like, I've said this in other segments, usually it's like, I don't sleep. Like, I don't sleep. So, when I'm with a chick, it's like, and, like, it'd be funny. So, like, I've learned that meditation calms my mind, and I end up falling asleep, and I gotta wake up just to know I was asleep. So, you know, there's that. But, and like I said, like, that's one of them things that I probably throughout my life told me, like, I ain't never meditating, but, like, you know, no, that calms my mind. But other than that, in my waking hours, like I said, another symptom is being task-oriented and detail-focused and, you know, stuff like that. Like, I can, like, because of my racing thoughts, I can be highly distractible. But usually that's more in the leisure, because don't try to use that against me. Like, I can't focus at work, because, again, I'm just saying, like, you know, I just be on good mode whether I'm working for an agency or... But anyway, so, you know, it is what it is. But like I said, throughout this channel, throughout this segment, I'm going to be bringing different things. Like I said, this is my second upload to this channel. This is probably my, like, 7th installment on the clinical check-in on my main channel. A lot of shenanigans on my other channel. It is what it is. But like I said, I'll get back to you another time. We'll continue discussing different things. I know I have a lot of different topics I'm going to be discussing on these Rico Talks. Up next, I don't know, but like I said, plan to come to you more frequent and more polished as time goes on. But like, comment, subscribe. I don't know what I'm going to call this segment besides DaBear Truth Clinical Check-In. Check us out on IG. If you know the IG. DaBear Effects Podcast. Like, comment, subscribe. Till next time.